This inlay, which is indicated for use only on the cuspid, fulfills a real need because this tooth has only a single cusp, which makes restoration more difficult. When doing the typical distal lingual inlay, as we have done for so many years, many dentists remember how difficult it was to achieve enough depth on the lingual aspect of the dovetail without causing an exposure of the pulp in this area. Because the inlay must draw with the box, it's a very difficult preparation. No hand instruments are used on this preparation. The lingual dovetail provides most of the resistance and retention form, and the distal hollow grind hangs off it. The distal hollow grind is cut parallel to the labial surface, and the preparation has an easy draw to the lingual. The armamentarium for this cavity is very simple because there is no hand instrumentation. We use the number 56 burr for the dovetail and the number 7404 for the hollow grind and the lingual bevel. The first procedure in the preparation is placing the lingual dovetail. You should notice that little extra depth can be achieved because it doesn't go deep on the incisal, as it withdraws directly to the lingual. We try to avoid making the isthmus too wide because the inlay must not displace distally. The 7404 burr of the Brasseler design is used to hollow grind the distal aspect. We attempt to keep the axial wall with little taper, which increases the lock against the dovetail. The hollow grind has a draw that is parallel to the labial wall of the tooth. And you can notice the easy line of withdrawal because there are no line angles or point angles to interfere. The last step is placing a light lingual bevel with the same 7404 burr. You can notice that the cavity draws directly to the lingual, perpendicular to the lingual wall, and there is a little lock or retention between this wall and this wall. There is a little extra depth on the lingual, which is allowed because the incisal aspect does not encroach on the pulp, as it would if the cavity were cut more on the long axis of the tooth. I first used this preparation on a patient in 1981 and soon realized that it is probably the easiest preparation we can do for an inlay because there are no hand instruments to be used and the plane of withdrawal is simple. I think inspiration for this cavity came from Dr. H.W.C. Bodecker, a German dentist, who in 1911 presented his slice preparation, which had some application for a 3-surface inlay but lacked resistance form, and especially in a 2-surface inlay. This picture of a casting ready for cementation shows the simplicity of this preparation. This produces a beautiful inlay, which fulfills a real need in those cases in which we cannot place a slot inlay because the cavity is too large or if there were previous filling with a dovetail present. This is an exciting preparation. A modification of this is the distal hollow grind with a pin. This preparation is done on cases where the cavity is quite large, so increased retention and resistance form is needed. In my practice, I find that about half the time we use this pin modification. As you can see, this larger cavity is exactly the same as a typical hollow grind preparation, except here at the end. When the cavity is otherwise completed, we use the number 4 round burr to place a counter seat, and a 169L burr cuts the pinhole, approximately 1 1/2 millimeters deep, parallel to the lingual draw of the cavity. You notice one of the features of this cavity is that the pin is placed as distant from the primary retention, the dovetail, as possible. This increases its effectiveness. As we place the number 4 round burr on the hollow ground wall, it is allowed to cut into the axial wall some so that the pin will not be placed too close to the margin. This counter seat is important as it serves to funnel the casting into the cavity and it gives strength to the pin where it is most needed. The 169L burr is placed in the counter seat and the pinhole is cut to draw on the same plane as the lingual dovetail. We do not allow the burr to make a larger hole than the burr itself, because when the cavity is waxed up in the laboratory, a plastic Wilkinson pin, number 700, will just fit in this hole. The impression for this inlay was taken in the usual manner, using the needle technique for the impression of the pinhole. This will be discussed later in the video. The distal hollow grind with a pin is a very satisfying procedure, because no other preparation would be acceptable for such an extensive cavity. We have many